How can we prevent the transmission of infection from the infected to the uninfected? The most important aspect is the general hygiene. Cover the mouth whenever you cough, then wash your hands. Cover the nose every time you sneeze, then wash your hands. Wipe with disposable tissue paper, throw it into the garbage can covered with a lid, and then wash hands. Do spit in a disposable tissue paper, throw it into the garbage can covered with a lid, and then wash hands. Hand hygiene is essential, imperative, either washing with soap or by clean rubbing by alcohol based sanitizer. It must be done carefully and repeated as often as possible. Use of surgical mask and personal protection equipment, also called the PPE, like the headgear, the goggles, the cap, the apron, the gloves, and all those things are required only when one is nursing or taking care or treating a patient of H1N1. Otherwise, personal protection equipment and surgical masks for general use are not indicated. Suffice it to say that regular hygienic habits of washing hands and then covering the cough and then sneezing and coughing into a tissue or into a cloth and disposing them of properly will go a long way in preventing transmission of the so-called prevalent and deadly infection. This is a poster to be stuck in our clinic waiting halls. Stop the spread of germs that make you and others sick. Cover your cough. How to cover your cough? Cover your mouth and nose with tissue when you cough or when you sneeze. Or if no tissue or cloth is available and if it is imminent that you have to cough or sneeze, do that into your sleeve of the elbow as shown here. So that way it prevents others from getting, not by putting the round cuffed hand before your mouth, but by sneezing or coughing into the sleeve when there is no other tissue is available. And of course, disposing of that in the trash can is very safely is important. And then once you are sick and you are diagnosed to have suspected H1N1 or confirmed H1N1, then a safety mask will help you not to spread the infection to others. That's very essential. Most important thing is cleaning the hands. Each time you touch the nose, sneeze or cough or touch any patient's equipment or treat a patient or nurse a patient, cleaning the hands with soap and water or alcohol based detergent, alcohol based cleansing solutions is essential. This is a CDC National Institute of Health guidelines, and this can be xeroxed and kept in our clinic waiting halls so that people can understand this message and then they can follow it. Remember, when one coughs, the aerosolization will be like this as far as around 2 to 3 meters. So the virus particles will be dispersed to that distance. The next slide here is this photograph shows the hand washing, which is an integral part of personal hygiene to prevent any infection, more so the H1N1 and other respiratory viruses which travel through contaminated hands. So remember, one important point is soap should be applied to both the hands, and one has to rub both the hands with one another and keep the soap in contact for at least 20 seconds in order for the germs to be killed. Just putting a little soap and little water on the hand is no use. After proper thorough rinsing of the hands under running water, the hands have to be dried, and then of course we can be sure that we have not transmitted the infection from the hands to elsewhere. In this picture are shown some masks, face masks, N95 respirators. This is an ordinary surgical mask or a face mask, which is a tri-layered tissue like cloth Only important thing is one has to snugly apply the mask so that there is no gap between the mask and the face, and then tie the ends up on the back, and then keep the nose and mouth completely covered by the mask. This is useful only when there is a case in the home, or when you are nursing a patient, or when you are treating a patient of suspected H1N1. This is a Chinese designed mask for community use, similar to this one, comparatively thicker one than what is normally used as a surgical mask. But this one is called what is called N95 respirator. This has got multi layers and has got a filtration capacity. The filtrability is very high, so even virus particles cannot travel through this, and this is to be eminently worn by all those people who are nursing or treating patients of severe H1 influenza who are hospitalized. Remember, these N95 masks are not for general use or used by general population. For that matter, general population at the moment are not asked to wear any masks, whether they walk in the road or go for any shopping or go and mix with any community work. Only thing is, whenever they know that there is an associated case in the surrounding area, or when they come in contact with a known case, or if they themselves are cases of H1N1, then there is a need for a face mask. Otherwise, routinely covering face mask is not required and not mandatory as recommended by the international agencies. It is essential, of course, to cover the cough, to cover the sneeze, to wash the hands thoroughly, and to keep social distancing.